This is an interesting case seen in a 16-year-old girl. Now, the history was quite atypical. She complained of gradually increasing distension of the abdomen over a period of 7 to 9 months. And over the previous 2 months, she also complained of lower abdominal pain and continuous discomfort. We did a CT scan on this particular patient, and these were the findings on a CT scan, which showed a large cyst occupying the entire peritoneal cavity, which was diagnosed initially as a mesenteric cyst. In view of the large size of the cyst, a decision to go ahead with an open approach was made with a simple justification that it would have been physically impossible to introduce primary trocars in such a massively distended and tense abdomen. Because if one had attempted to pass in a primary trocar, surely it would have resulted in perforation of the cyst and leakage of all the cyst fluid into the peritoneal cavity, which would have proved to be dangerous, as the histology of this particular cyst was unknown at the time of surgery. When we opened the peritoneal cavity, the cyst started pouting out, as you can see. We dissected the cyst all around, superiorly, laterally, and we found that there was a pedicle at the inferior aspect, which was twisted, which perhaps explains why the patient was experiencing abdominal discomfort and persistent pain over the last 2 months. However, fortunately, the left ovary was normal, as you can see in this particular picture. We removed the cyst, and this was the picture after the complete removal of the cyst. The uterus was normal, both sides adnexa, that is the tubes on either side, and the ovary was also normal. This picture we have taken purposely to highlight the fact that the uterus, both the tubes and the ovary were absolutely normal. This was the uterus is made more prominent by putting a pack just below the uterus in order to lift the uterus so that the visibility of the uterus and adnexa is very good. This was the excised cyst. As you can see, the large size. It weighed 7 kilos and 300 grams and was roughly 40 by 30 centimeters in size. This was the histological picture which showed columnar and cuboidal epithelium. There was no evidence of any malignancy anywhere. Thank you.